Hello, hello everyone, and thank you for joining us for today's webinar, A Tale of Two Pandemics, How COVID-19 and Racism Intersects with Intimate Partner Violence. My name is Mighty Fine, and I'm the Director of APHA Center for Public Health Practice and Professional Development, and I'll be serving as your moderator for today's discussion. As the title alludes to, this webinar aims to address the scope of intimate partner violence, or IPV as we're more familiar with it as, in the US and the impacts of both COVID-19 and racism. And thankfully today we have two awesome panelists who are going to discuss this issue through the lens of culturally specific organizations that work to address IPV and the related issues. Just as far as some housekeeping, if for those of you who need closed captioning, that link is available in the chat function. So if you click on that, that service will be available to you. We are not providing continuing education credits for this webinar, and a recording of the webinar will be available on APHA's website within a week or so. So just so you know, the way this webinar will happen, think of it as like a podcast, or if you're having a conversation around a table with really knowledgeable folks, both Condencia and Karma are, and then you'll have an opportunity to ask questions at the end, but be sure to post your questions in the Q&A chat box throughout the webinar, and we'll be sure to get to as many as we can towards the end of our conversation. So by way of introduction, Condencia Brade is the co-founder and executive director of the National Organization of Sisters of Color Ending Sexual Assault, or CSE, which is a women of color nonprofit dedicated to working with communities of color to create a just society in which women of color can live healthy lives free from violence. This organization was born out of the desire of women of color in the anti-sexual assault movement across the country to reclaim their leadership and ensure that inclusion of their experiences in ending sexual assault. We also have joining us today Karma Cottman, who is the Executive Director of the DC Coalition Against Domestic Violence in Ujima, the National Center on Violence Against Women in the Black Community, which is a project of the coalition. And before joining the coalition in 2010, Karma was employed at the National Network to End Domestic Violence as a Vice President of Policy and Emerging Issues. She directed the agency's policy agenda and supervised their state coalition and housing technical assistance projects. She worked closely with national policy partners to strengthen federal legislation to effectively respond to the need of all survivors of domestic violence and federal agencies to enhance violence against women programming. Since '94, Karma, who's also a Washington, D.C. native, you know, I represent that Southwest myself, has worked with numerous national partners to address emerging issues in domestic violence service provision and sits on several national committees. So we have two awesome panelists today, and I think you all are in for a treat with a very hearty discussion. And as I told you both, we have a range of folks on the call today who I'm sure who have a variety of understanding and perspective on intimate partner violence, but I'd like to do some grounding. So if either of you, from your perspective, can tell me how you define intimate partner violence, I think that'd be great to get us started.
Thanks. And just before we get started, I want to thank you, Mighty, and thank you, Yato, for having Condencia and I on the call today. This is a critical conversation, and we are so happy to join you and join those of you all have joined us on the webinar. So we define intimate partner violence as a serious public health issue that affects really millions of Americans across the country. It's defined as physical violence, sexual violence, stalking, or psychological harm by one partner, a current or former, against the other, and is intended to maintain control over the other. I do like to make sure that we are very clear that while sexual violence is included in the continuum of abuse that's asserted to maintain power and control over another, it's also standalone and can be asserted in outside of the intimate partner context. And I know that you all have broader conversations around sexual violence, but I want to make sure that while we highlight it in this context, that we are also clear that it happens with strangers and family members outside of the intimate partner setting.
Condencia, is there anything you'd like to add to that?
Hi, good afternoon, everyone, and thank you so much for having me on this call. We work
Absolutely.
a lot with Ujima, and so very thankful to be a part of this conversation. And just looking at the range of folks that are on and joining the conversation, I think I'm really looking excited to the dialogue. I think Karma really outlaid what I would have said in terms of thinking about recognizing that sexual violence can be one tool that a harm doer can use in an intimate partner violence situation, but understanding that, yes, I echo Karma's thought that sexual assault and sexual violence is much broader and encompasses a range of issues and that can range from infants all the way to older adults. So yeah, thank you.
Awesome. Thanks, appreciate that. So in the context of what you both share, we know that data from CDC tells us that 1 in 4 women and nearly 1 in 10 men have experienced contact sexual violence, physical violence, and stalking by an intimate partner during their lifetime, or in some reported form of IPV-related impacts. So we know that IPV is wide-ranging and wide-reaching. So can you talk a little bit more about that and your perspective in regards to what populations are most affected by this type of violence?
Sure. So thank you. And yes, the CDC information does actually highlight the impact of intimate partner violence across the country. And as organizations serving communities of color, and particularly women of color, we certainly see a disproportionate impact on communities of color. As it relates to homicides, African American women are more likely to be murdered by their harm doer, as are Native women. As in terms of the prevalence for young women and young girls, the same is true for girls of color. And when we see disproportionate impact in terms of housing stability, in terms of public health, access, in terms of maternal and infant care, those same rates in terms of how it shows up for communities of color, and particularly women of color, show up in terms of incidents of domestic violence. And I would also expand that when we think about incidents for the individual, there are also disparities in terms of access to services, and both from an individual perspective in terms of accessing individual services, as well as for community of color specific organizations in accessing resources at the local, state, and national level.
Thank you for that. Condencia, anything you'd like to add?
Not at this time, no.
Okay, great. So thinking about what you just lifted up, Karma, in the perspective of both of your organizations, and you started to drill out that some of the specific issues for women of color, is there anything else you'd like to add to that and talk a little bit more about what's driving these inequities and why is it important for organizations like the both of yours to be uplifted and secure and develop services as you do?
Sure. So there are certainly long-term structural disparities and structural racism that has impacted communities of color, and in particular, our organization serves Black women and Black women and girls, and so addresses those structural racism that has also impacted our access to services from a public health perspective, as well as from law enforcement. So a perspective in terms of access to justice, whether you're talking about from a law enforcement response to access to justice within the court system, access to justice when you're talking about child support, gaining custody of our children. So a long range of systemic and structural racism that has impacted our communities and has impacted our access to justice from a public health and a criminal legal perspective. And when we talk about culturally specific organizations, those same structural, that same structure of oppression has also impacted our access to to funding. And so what we know from community-based, culturally specific organizations is that we also have challenges in accessing federal funding, in accessing state and local dollars, because systems have been set up that ensure that organizations that have always had access to dollars and have not actually served or been developed to serve our communities have had long-standing access, which has then locked out communities of color in our organizations.
Condencia, anything for you to add there?
Yeah, just to add to what Carmen said, when we talk about culture-specific communities of color organizations, just to kind of echo Karma's thought and lift up that these are organizations, culture-specific communities of color organizations, are organizations that are by and for the communities of color that they are serving. And so, you know, oftentimes we talk about Black-led or women of color-led, and those that's very important, but want to differentiate communities of color organizations as those that are not only led by women of color or people of color, but they're also centered and their practices are for the specific racial ethnic community they are working for. So I think that's really important to kind of lift up and add to Karma's thoughts.
Thank you. And just specifically, is there anything you want to draw from what your organizations are doing to kind of counter what we see happening, so folks listening get a better understanding of not only your perspective, but what your organizations are doing to address this issue as well?
Absolutely. So Condencia and I work in partnership in a lot of various initiatives related to responding to the disparities for women of color, and particularly communities of color, in accessing resources and in accessing services. So right now we have been hosting regional meetings with culturally specific organizations, as Condencia just defined, to walk through how we can access funds. So just, you know, one of the very easy barriers for culturally specific organizations is that we don't even know that the funding exists, right? So raising our awareness around funding that exists specifically to address domestic violence and sexual assault, intimate partner violence in our communities. Ensuring that once we have access to those funds, we have the infrastructure to support grant management and actually successfully managing grant funds. So that's one of the other things that we work with our organizations. And so from that rubric, as a full organization, as Ujima, we provide those kinds of hands-on interaction with culturally specific organizations through training and technical assistance. We have a research and evaluation work group that really looks at gaps in addressing domestic violence and sexual assault in our community, in the Black community. And it was really important for us to engage with this broad range of researchers that are from our community, right? And that have a history of conducting culturally specific research that's responsive to and led by our communities. And we also have a policy arm. And so I saw in the chat that our one of our policy folks, Megan, is on the line and in the chat. And so we have a policy team that really looks at developing and responding to both local, national, and state policies that impact survivors of intimate partner violence and sexual assault, and ensuring that those policies are responsive to our unique needs and that they address structural racism, structural oppression in the ways that policies may do so. In addition to that, we provide intensive training and technical assistance, both to culturally specific organizations as well as to what we name mainstream organizations that serve culturally specific communities and communities of color.
And one of the things that you mentioned that I want to pick up on is this idea of access. So we can think about access in a multitude of ways, but kind of linking back to, we talked about some of the systemic structures and barriers that those experiencing intimate partner violence face. What are your thoughts around, as far as access to care and for the communities that you serve? What are some of the challenges there, and what more should public health be doing to dismantle some of those barriers?
So some of it starts, Mighty, with the fact that for a very long time, when we think about intimate partner violence and when we think about sexual assault, much of the response has been rooted in the criminal legal system. It inherently has challenges in itself. And so, you know, a lot of the attention has been paid to ensuring that police are responding and in the court systems. And those are actually very important responses, but the same has to be done in the public health spectrum. So looking at what can healthcare providers do? How do we work with mental health providers to ensure that survivors have access? To make sure that in terms of those responses, that they are also culturally responsive, right? So that make sure that they are informed by the culture of the survivors that they're working with, that we're using language that resonates with those survivors, that we are ensuring or formulating remedies that resonate with our communities, because oftentimes when we go straight to a systemic approach, right, and we look at, well, we expect for folks to come in for medical care, it doesn't take into account the transportation challenges that individuals may have, the insurance challenges that individuals may have, as well as the long-standing history that our communities have with some of these systems, you know, where there have been long-standing histories of oppression and racism. And so our interaction with those systems then becomes, you know, clouded by, as it should be, with that very real history. And so there has to be intentionality in our outreach to communities of color. There also has to be intentionality ensuring that the individuals that are providing services look like those individuals that they're serving, are informed by and engaged by within their reality. So actually understand the individuals that they're attempting to serve. And that does, you know, I use that word intentionality on purpose, because there has to be thought and planning and intention in making sure that our systems are responsive and that whatever responses we develop are actually grounded in the cultural realities of the individuals that we serve. And those tend to be, that lack of intentionality tends to be one of the biggest barriers that our communities identify.
Great point. One of the things that's making me think of is that oftentimes when we see things portrayed in the media and the way stories of Black folks, how it's told, it's almost as if there's a lack of value placed on that life. So I'm sure it plays out in the space of intimate partner violence as well. So that can even relate to whether if someone is believed to be in that situation or not, or you know, you people are prone to violence, and those stereotypes like that I think speak to some of the inequities that we're seeing as far as access to care and services and even funding. So I don't know if there's anything either of you can talk about what needs to be done as there's this spotlight right on race relations and racism right now in this country. What should we be uplifting to showcase that these Black lives need to be valued, and services and support should be provided just like they are for others, or just communities of color more broadly?
Condencia, I'll let you respond. I think she may be coming off mute. So, you know, a few things. And so that's so loaded, Mighty, because it is so true. And it's what we hear and see with survivors is that, you know, bias is very real, right? And bias is happening, it happens in all of the systems that they engage with. And so for survivors of color, particularly for Black and Brown survivors, what they see is that because our lives are not valued, that very often when they are engaged with systems, they're not seen as victims, right? That the way that we respond is seen as threatening. And so oftentimes when you talk about law enforcement coming on the scene in intimate partner situations, you will see dual arrest where the victim is arrested, you know, at the same time as the harm doer. That there is a lack of understanding, you know, sometimes our strength as a community, and particularly when I think about this, I think about this moniker that we are strong Black women, right? And that oftentimes works against us when you're thinking about the ability to access services from a community-centered place, right? When we think about systems, that our parenting choices aren't valued. And so when individuals are making decisions about how we parent, and they don't understand how our parenting choices, the parenting choices that we make, then we see child enforcement intervening in our cases, that we see that Black women are losing custody of their children at higher rates. And certainly then access to resources, you know, when we don't have the financial resources to navigate systems, you know, that then becomes a challenge. And so, you know, very often it's the things that we know from our community-based organizations where they are providing, you know, not just shelter, but they're, and not just counseling, but they're providing food, they're providing transportation, they're making sure that folks can get to the doctor. You know, it's providing those basic care needs, and then making sure that people don't confuse the racism with challenges around economics, right? Because very often what I see, particularly for communities of color, is that the approach for us tends to be centered around economics. So the assumption that we are all, you know, low income. And so there are not multi-layered approaches for survivors of color that take into account that we are diverse, even when we talk about culture, right? And when we talk about community, particularly for the Black community, very often folks don't think about the fullness and diversity of our community, that we are, you know, African-American, Afro-Latina, Afro-Caribbean, African immigrant. And so we require different perspectives, different responses, because our community is diverse as well. And so all of those things come to bear when we think about what needs to be lifted up for our community. It's the access to resources. It's understanding the challenges before we step into the door as survivors, what we had to overcome in our communities, so that you can provide resources and responses that are tailored to our individual and collective needs.
Awesome, thank you. And Condencia, want to add to that at all?
Yeah, I mean, I think so much of what Karma lifted up is so important. And I think to your point of public health and really, you know, the work that can be done in addressing these issues, I think there's this piece to be added that says that, you know, public health is an opportunity to think about these issues of, when we think about intimate partner violence and issues of sexual assault, that there's an opportunity to really center this as part of women's overall health, and thinking about it in that way that helps to dispel the issue is, as you mentioned, that these communities are just violent and that violence is inherent in these communities. And that really, no, they're not any more violent than any other communities. I mean, what we see, the reason why we see so many issues of intimate partner violence showing up for women of color is because the systemic inequalities creates a heightened level of vulnerability. And so that's what we're seeing. And so they're not any more violent, but what we see is that their access to resources, their access to support, their likelihood of being believed if they show up and report to someone, their likelihood of being, of even engaging with them in such a way that they're able to provide a picture of what is happening in their lives without being, you know, unfairly judged, those opportunities are limited. And so what we see happening is we create, you know, and a colleague of mine once said, we create this unintended alibi for harm doers to be able to continue to abuse women of color without, you know, feeling like there's a sense of accountability. And we shoulder all of that onto the communities to address it without realizing that we are providing societal alibis that allow these issues to continue to happen to women of color without really centering their access to health and quality of life as being an important part of our discussions around public health.
I like that. Next time you hear me talking about societal and unintended alibis, I'll credit you. But I like that. But what it makes me think of is when we think about neighborhood conditions and we're told to, let's say exercise and walk on, walk outside and eat well. And you think about this kind of this collective disadvantage that you're talking about, those things are not even feasible because your neighborhood and your environment is really conspiring against any of those changes that you would want to make. So it talks about, I think it uplifts this idea that it's not about the individual, but it's about the contextual and social factors that sometimes shape choices for us. And I think that's a great segue into talking about COVID-19 and how this really just unearthed for some folks, but for some of us, it was a stark reminder about the health inequities that we're seeing broadly in the U.S., but also in regards to intimate partner violence. So can you talk a little bit about how when we're trying to do public health measures, right, stay at home, distance, and those things that we know that are effective in disease mitigation and prevention, but yes, there are some unintended consequences of it. So if you can talk to us a little bit about how COVID-19, the stay-at-home orders, how that's impacting in intimate partner violence.
So absolutely, we've been doing a lot of work around the impact of COVID-19 and the subsequent stay-at-home orders in communities of color and for Native women. And so, we, as you said, Mighty, what has happened is that, is unearthed and underscored what have been longstanding systemic inequities in terms of access, in terms of public health responses in our communities. And so what we saw for a lot of our communities that were already isolated is that they became further isolated as it related to and in response to the COVID public health emergency. And particularly for survivors of intimate partner violence who were stuck at home with their home doer, for individuals who were stuck at home with someone who was assaulting them, then this was an extremely dangerous time. And what we saw from culturally specific organizations, those organizations serving women of color and Native women, is that the demand increased almost immediately. And it ranged everything from translation of materials. There were a lot of materials that came up around, how to gain access to services, access to resources, et cetera. And so our organizations were having to translate that information, not just in terms of language, but also what does this mean when you're at home with your harm doer, right? When we heard from culturally specific organizations around, having to do what we just talked about. Our folks were living in food deserts, so they had to help folks get to places with fresh food. A lot of the survivors that we serve are also on the front lines, and so they weren't able to stay at home. They had to go out and go work. And so we see that incidences of intimate partner violence also increase in times of economic challenge. And so, we had this large convergence of things happening at the same time that also heightened what have been longstanding systemic inequities. And on top of that, Condencia and I often talk about the fact that culturally specific organizations are doing more with less. And so what the other thing that we saw with our communities is that on the service side, while this was happening, that our organizations didn't have access to a lot of the resources that were coming out in terms of the CARES Act. And so, our organizations didn't have long relationships with banks, so they weren't getting access to payroll protection loans and things like that. And so there was this real, I use the term convergence because that is exactly what it was, right? We knew that these things existed, and here we had COVID come and again shine a spotlight on it.
Absolutely. So thinking about COVID, and I don't know if you are like me, there were different things I saw on social media, of things to do if you are in that situation or experiencing intimate partner violence. And then there's a lot of things that went to like telemental health, telehealth in general. So are there any programs or strategies that you all are implementing to help counter what we see happening in the home and to try to prevent it from happening?
Absolutely. So a lot of our programs did move to providing remote services. So they did things like bought computers and laptops and tablets for the survivors that they were working with so that they could maintain contact with the counselors that they had been working with, so that they could continue with support groups. We also had organizations that really said, you know, we will utilize mobile services. So they were actually taking their services to survivors in a mobile context. And so using vans and other things to go to community to not just serve survivors in the context of, you know, here's what's happening in terms of domestic violence or sexual assault, but also to say, we know you need fresh food, so we're going to deliver groceries. We know you need to be able to ensure that your children have access to the internet, so we're going to make sure that we get hotspots and things like that to you. And so, you know, one of the things that we talk about in terms of the work that we do is that we have to see women, men, children, we have to see us as our holistic selves, right? And so the violence that happens from an intimate partner perspective doesn't just end with that one time between the partner and that individual, but you have to look at what is that family experiencing in a whole, as a whole, right? And so we have to make sure that when we think about how do we serve survivors, and culturally specific organizations utilize this in regularity in terms of their practice, they think about, you know, does this person have transportation to get to work? Does this person have housing? Do they have access to fresh food? Do they have the internet in their home? And so they're looking at providing all of those services as a part of also responding to the violence. And we saw that be heightened in terms of COVID, where organizations were providing those services remotely. They were going out providing mobile services. We also did work with a lot of organizations that are serving youth. And I think that there was a misnomer, right? That, oh, well, kids use online services all the time, so this should be fine for them. They'll be able to access us via chat and everything else. And what we heard from service providers is that while that is true, they also do require a level of hand-holding to walk through various systems. And so there was a need for mobile services for teens and youth to go and help teens and youth access services, because they needed someone to walk them through the systems. They also needed to be able to explain, why is it necessary to wear masks? You know, what are the preventative things that they needed to do to keep themselves safe during this time?
So thinking about blending kind of the two issues that are on the forefront here in relation to intimate partner violence. So what is it that you think the two pandemics are, how is that intersection interplaying with both COVID-19 and racism interplaying with IPV, but also maybe taking it a step further and acknowledging there are services that we can do to intervene, right? But we also recognize that there are things we can do way upstream. Is there any position that you have that you can add to that, the conversation about thinking about the upstream approaches and recognizing that we got here because some of those intervention and prevention mechanisms aren't funded or supported in the manner that they should be. But I just think it's appropriate to put that in the context of thinking about way upstream approaches, what we're doing now, and then where we can go in the future as we're seeing the intersection of these two issues.
Absolutely. So, we frame and talk about intimate partner violence as a form of oppression, because it really is. It's a form of oppression and a form of exerting power and exerting control in the context of the home. And so it does, when we think about how has that converged in this time, where there's also been more shining of a light on racism and how that has impacted the lives of individuals of color and Native communities in our country. What we know is that, it's about long-term systems that have been in place to exert power, to exert control over communities and to disenfranchise us. And so, that is very real in terms of the context of the work that we do, because we address systemic barriers, right? And we have, Condencia and I are like, we've been thinking about this for a long time. So someone has just, unleashed us really, and thinking about, access, Mighty, from an individual perspective, from a community perspective, and from a systemic perspective. And so what does that look like? For an individual, it means resources to maintain your life, right? It means actually being safe in your home. It means having safe and affordable housing. It means having access to fresh and safe food. It means having access to transportation. And that there are systemic barriers that prevent individuals from having that access. And the fact that it is overwhelmingly people of color and Native communities that we see impacted by these systems disproportionately it's not at all unintended, and it is a consequence of long-standing systems. And so part of what we are challenged with today is, how do we interrupt those systems to better the lives of individuals, right? And so that looks like everything from ensuring that we have the funding that we need in community, to ensuring that we have the infrastructure that we need in community, to ensuring that the individuals that are making decisions around policies understand and are from our communities. It means ensuring that culturally specific organizations and those communities that have been disparately impacted are represented in making those decisions, right? It means that as we look at research and public health approaches, that they are also grounded in those realities, so that we are by default sometimes challenging the systems, but we want to make it intentional that we are challenging those systems.
Interesting. So taking on that perspective, and you both come from culturally specific organizations. So how do you think you are positioned to counter maybe some of the shortcomings that you just mentioned, to counter the barriers, but also to ensure that you're addressing intimate partner violence from a comprehensive manner, and then thinking about the unique quality of a culturally specific organization, like you mentioned, because we know that there are some shared experiences among communities of color and Native populations, but we also know that there are some unique qualities too. So not working for a culturally specific organization, I would imagine that that's some of the unique qualities that you all bring to the table, is that you are able to, yes, highlight the shared experiences, but also engage in those new cultural nuances to ensure that the needs are adequately addressed.
Yeah.
And then see, I saw you come off mute, so I'll let you go first.
Sure. I I want to respond to that, and I also want to lift up another issue as well. I think and I mean, and you phrase it really well, Maiji. I think one of the things that culture civic organizations, one of the things that make them unique is that they're organizations that, one of my colleagues says it really well, fundamentally understands that culture permeates in the way people seek out services and engage in services. And as such, culture civic organizations, they provide the necessary procedures, processes, and services that reflect the cultural needs of those survivors that are seeking out support. I think there is, oftentimes folks will say to us, well, do you think that there should be only culture civic organizations and there shouldn't be programs at what we define as mainstream organizations? Absolutely not. But we believe that survivors should have choices and options. And why we while we may work with mainstream organizations to ensure that they're culturally competent services, culture-specific organizations are built and grounded in not only the way that our communities speak about these issues, and not just the language of the particular communities, but how they engage and talk about these things. Words that we use, like intimate partner violence, that may not be how it's operationalized in those communities. We need agencies that can understand that and can build programs around that are reflective of and grounded in the way our communities seek care and how they engage in services, and what are the healing practices that are important to them. One of the things that you know, I love about the work that we do is redefining what we call core services. And oftentimes when we think about what are core services in response to, you know, intimate partner violence, for instance, we think of things like, you know, brick and mortar shelter. We think of things like, you know, we need to have, you know, this idea of safety is kind of draped in a mainstream concept of that, without recognizing and valuing for communities of color our connections to family and community. And what does that mean? Sure, we want safety for ourselves, and that is extremely important, but many of us cannot separate from our communities in the way that mainstream services often require us to do. And so I think, you know, what Ujima and Cisse is really about is putting forth the needs of our communities and putting forth the fact of, we know what we need, but we want the opportunity to be able to craft services, to craft responses, to craft policy that reflect what we know. I think, you know, Karma said it really well, is that our communities aren't less than. And when we talk about capacity, it's not that we have less capacity. We know what we want to do. We often are not able to access the resources to do it and do it well. And I think with that, when you talked about the kind of larger, you know, what are some of the larger issues, kind of the upstream, I think you called it upstream, right?
Yeah.
You know, it's thinking about leadership. You know, it's thinking about leadership. You know, I think for far too many times, there are resources, there are research, there is a list of things that are done for our communities, but not by our communities. We see that oftentimes we need to engage communities of color and in directing and formulating those policies and procedures that we need to have their leadership in. Oftentimes we've been doing these, you know, as Carmen said, we've been doing these listening sessions. Before COVID, we were doing them around the country in person. And then after COVID, we've been doing them on this new reality of virtuality, right? And one of the things that we've heard women of color saying, you know, I feel like I need permission to say what I know about my community, because I may be in an agency that has a commitment, but I'm not leading that. And I'm not able to influence what the agency may say or do. And so whether we're talking about looking at agencies that are responding for housing or public health or research, you know, when we talk about research, we know how to get our communities to talk, to share. We know what that looks like. But when you think about the opportunity for many researchers of color to be, for their research to be valued, to be lifted up, to be leading the way the research is done, and not just included in the conversation, there's a gap there. And so I think if we're thinking upstream, we've got to really provide, and I love how Karma said, intentional spaces for the leadership of our communities to direct some of this work. And so I think that's an important piece as well.
Yeah, I like that. Karma, I know you're going to say something. I just wanted to add quickly, it's almost as if getting away from this idea of some group coming in and empowering the community and not acknowledging that the power is already there. It's just it being channeled and harnessed, because as you've mentioned, the community knows the issues. They know, they have great ideas with solutions. So I like this idea of having the duality of, yes, we need these culturally specific groups because they speak to the needs, and they also provide a forum for where the power can be harnessed and then utilized as we're creating solutions and prevention mechanisms. Carmen, you were going to say something?
I was just going to say, you know, I fully agree with my sister, and I would just add, you know, in terms of leadership, and that leadership has to be coupled with the resources and funding to support it. Because very often what happens for our community is we're doing these things for free, right? We're leading efforts, and we are delivering the food, we are the researcher, we are running the program, we're doing all of these things for very little to nothing. And so, you know, what our organizations need is we need the funding to make these things happen. We've got all of the ideas, we've got the expertise, we have not had the investment in our organizations. And, you know, Mighty, one of the things that is critically important is to understand that organizations doing this work, you know, in a mainstream context have been funded for 30, 40 years. And so the expectation that, or culturally specific organizations, that really the only funding stream that exists right now for culturally specific organizations addressing intimate partner violence is out of the Violence Against Women Act, and that was formulated, that specific funding stream came in 2013, right? And so you're talking about 7 years of a very small pot of funding for culturally specific organizations, right? Versus 1994 when VAWA was funded, or versus 1980s when you had the Family Violence and Prevention Services Act out of Health and Human Services, and there's still no specific funding in Health and Human Services for culturally specific organizations addressing intimate partner violence and sexual assault. So it's, you know, that we need the investment in our communities to support our leadership, and it needs to be long-term investment that supports the development of our capacity to lead these. Because, you know, I see very often, you know, there'll be a grants management class. So here's how you manage your grant. But if you don't have any funding, right? You know, I see that the same, you know, we do job training for communities. We saturate communities of color and Native communities with job training programs. But if the jobs aren't there, right? If the careers are not there for folks to step into, then it's an exercise in futility. And we hear that very often from our communities, that we've got the leadership skills, we've got the capacity, now you need to come with the funding. And that does come with recognizing that that communities of color and Native communities need to be in position to make decisions around the resources that need to be dedicated for our communities.
Interesting perspective. So it's kind of keeping in line with the ensuring that resources are available, do either of you have any suggestions on how we change or influence the system and how things are funding, whether it's on the local, state, or federal levels, so that there are more funds available for these culturally specific services that address the needs of Native communities and communities of color?
You know, I think there's multiple things that can be done, right? I think from a policy perspective, there's the introduction of, we have talked about bills out of the Family Violence and Prevention Services Office that would specifically fund culturally specific organizations on a local level, setting aside funding that is directed to culturally specific organizations. When we look at funding for public health agencies, ensuring that there are dollars specifically for public health responses directed to and guided by communities of color. So it's really lifting up and ensuring that as we're allocating dollars, that we're ensuring access for communities of color, and that we're prioritizing culturally specific responses. And Condencia, you know, make sure that we define that culturally specific as by and for our communities, because the access has to be with organizations that are led by and developed by culturally specific, by communities of color and Native communities.
And if I can add to that, we see this in, and I'll take a moment, Mighty, to say that, you know, we see this in the response to COVID. I mean, in the funds that are coming out, and I will take liberty to say, we need to direct money to communities of color organizations to address intimate partner violence and sexual assault. There is no particular money that is going to those communities to do that. And yet we lifted up the challenges, inherent challenges, when we think about COVID within these communities, when we think about, you know, we have We have folks that are trying to find, safe, resources, housing. I mean, our communities have become their own kind of, running these food relay programs that they just, started up in a minute, trying to do that. And without any funding, being able to get, resources to provide the personal protection equipment that is needed to continue to provide those services. Some of our organizations do not have the resources to do that. Yet we do not have direct funding stream in COVID that is putting money into the hands of communities of color organizations that are addressing intimate partner violence and sexual assault. That is a huge gap. And so our communities, we have advocates coming out of their own pockets in order to provide services, in order to provide responses. That shouldn't be happening. Not when we are, what we recognize and we talk about the impact of COVID. We are seeing it in the news. We know all the statistics that our communities are being disproportionately impacted. And then when you put on top of that these incidents of, intimate partner violence and sexual assault, they're further impacted. Yet we don't have funding streams that put money into the community-based programs that they go to and are, and again, these programs, it's kind of like when they go to the Culture Spirit program, they are, it's kind of like they find one need and they find, such support there, they bring everything. So if they're trying to fill out a form for, to access unemployment benefits, they bring it to the Communities of Color, Intimate Partner Violence Agency, because that's where they found these connections that they need support for. But again, they're not able to access funds. So I think to your question, I think we really need to be looking at, some of this money that's coming out for COVID and asking the questions of how is this going to address, how is this getting into the hands of communities of color organizations that are responding to the needs of intimate partner violence survivors?
So what I'm hearing you saying is that there's some definite advocacy that's necessary and needed, because there are so many other decisions, let's just say, that go into determining how those funds are spent or how it's even crafted. And unfortunately, some communities of color are not always given the attention that they need broadly in those decision-making processes. So
absolutely.
And so, go for it.
I was going to just add that I think what happens in, when we think about public health and the context of health, I'm a big believer in this context of health and holistic health. When we think about that, we think of incidents, and I think sometimes what gets missed is the connection of intimate partner violence and, issues of intimate partner violence and sexual assault being at the root and being a propeller of some of these other systemic issues that we're seeing, right? And so, whether we're thinking about, childcare, food insecurities, all of these things that, if I can have you think for a moment of, a woman of color that's in an intimate partner violence is having to constantly navigate this idea of safety and well-being for her and her family, and navigate that on a daily basis, right? And now they have to navigate this idea of this safety in terms of the intimate partner context, but also safety in terms of COVID. So now I have to navigate keeping my family safe in terms of COVID. And on top of all of that, I now have to figure out, how do I do all this? At the same time, how do I find space to be able to take care of myself? So what we're seeing is programs are telling us about the increased level of depression and mental health issues within our communities, because women are struggling to do all of these things and not even having the space to be able to engage with a program to get support for their needs. And so we have this survivor that's there. How do we then look at, ensuring that they have access and they have to the needs that they may have? And so when we think about issues of, childcare and thinking through, how do we provide childcare so that women can be able to get, access to childcare so they can be able to go out and safely do their jobs. Well, we have to think about where are the opportunities that are directing funding to allow our communities to access childcare funding. And so when money comes out, how is that getting into the hands of women of color and communities of color specifically? So there's this kind of layered issue that often gets missed, and we're often marginalized even in those systems that are supposed to be addressing our needs.
Great point. And thinking about that and staying kind of with this intersection with the intention of this webinar, and if the numbers we're seeing now, it's any indication that COVID-19 is certainly a part of our immediate future, right? So taking that in context with how we know systemic and structural racism further exacerbates inequities, and we know that system change is necessary, but that's something that's going to take a little bit longer to happen. So can either of you provide any concrete examples of how medical providers or public health or other service providers, what is it more that they should be doing to address these specific issues? So if there are folks listening today, what should they be doing differently? We talked about including community in decision making and ensuring that services are culturally specific. Are there any other thoughts or suggestions you have in that regard?
You know, I think, you know, one of the things, Mighty, is that we think about systems change as this long-term thing that, you know, happens in the way off, but systems change happens every day in our daily actions, right? And so in terms of, you know, public health and what can medical professionals do, one of the most important things is to become educated, right? And to reach out to organizations, educated about who and where are those culturally specific organizations in your communities, so that when a survivor does come and is seeking help, you know who to refer them to. You know, one of the things that we've seen for a very long time is that folks don't even, when we're asked about, you know, what are the culturally specific resources, when someone comes to them and asks for those resources, that they don't know. Right, and they just go with the organization that they've heard about, and don't necessarily know who are those organizations that serve and are developed by and for the community that is reaching out. And so that's really important. And then to, you know, sometimes we have to make room at the table that we're sitting at when we recognize that there needs to be the voice from that community sitting next to us. And so what does that mean? In our communities every day now, as public health professionals, we're making decisions about outreach that needs to happen in our communities. We're making decisions about resources, something as simple as, you know, who's going to do home visits, or how are home visits going to be conducted right now, given that folks are under a stay-at-home order. And so who's making those decisions, right? When you're sitting at those tables making those decisions or having input, and you look next to you and there's no one representing the community that is most impacted, then how do you make space for them? Those may feel like long-term issues, but they're things that we can do right now to make that space available that actually does shift the system, right? And they may feel very small, but it does make a difference. And the challenge for us in our professional capacity is that sometimes that means that we may not be sitting at that table, right? That we may not be the person that gets called upon in order to make space for someone else. And that is critically important right now when we look at, do I have the necessary skill set, or do I have the knowledge to represent the community that is most impacted? You know, whether it's from a structural perspective, whether it is impacted by COVID, you know, on a daily basis. So I live in Washington, D.C. I live in Southeast Washington, D.C. And when COVID first started, I was looking at where am I going to go to get fresh food, right? My grocery store, when I went to the grocery store, I bought chicken. I got home and all 3 packs were spoiled. All 3 packs were spoiled. Well, I could run and jump in my car and go to the next grocery store. But what about that survivor that can't do that? You know, what about that individual that can't do that? We weren't going to get on Uber. We weren't taking Metro. And so there's just the reality of all of those things. So what does that mean we can do now? The advocacy that we can do right now is around, you know, when we're in our grocery stores as individuals, that we can say, you know, what's going on with the food selection? And that's outside of our just, you know, our professional capacity. That's in our everyday capacity, but it translates to our professional capacity, because when we're working in the public health setting, we have power, right? We have power to say who gets access to services. We have power to say whose voices are most important. And so right now, particularly, it's time to lift up the voices that are representative of those that are disproportionately impacted.
And if I could add, I would just say, I think is thinking about critically, how do you talk about it? I think talk about it, and talk about, you know, talk about issues of intimate partner violence in a way that is connected to health, and, you know, being able to talk about that. Being able to ask the questions and do the assessment, to be able to, you know, as Carmen said, know who's in your community and build relationships with those people that are in your community. Involve them in things that you're doing so that you can be able to make, you know, referrals knowing who they are. But I think it's critical to ask those questions when you are, when you're engaging with women and children. Ask the questions. You know, and for some folks, if you come out and say, are you in a domestic violence situation? They're gonna say no. And so you have to be really intentional and think about, how do you ask the question? I think partnering with folks is a great way to do it. I also think, again, always keeping in mind this kind of upstream thing, as you remind me of, you know that across the country, there are national organizations that are that work within communities of color. And so, you know, there are culturally specific domestic violence national organizations, and there are culturally specific sexual assault national organizations. Oftentimes there are toolkits and so forth that are created within public health, and, you know, whether we're talking about, you know, the OBGYN sphere or pediatric sphere or the National Public Health Association. I think, Mighty, do what you all did. Reach for, connect with the national communities of color organizations. Many times these entities connect with mainstream domestic violence and sexual assault providers and do not include communities of color national organizations in crafting those toolkits. And so toolkits gets crafted. I remember going to, you know, a doctor, and they said, well, have you been impacted by domestic violence? And I really, seriously, Mighty, I just looked at her, because I'm like, now, why would I tell you that?
Right,
You know,
right.
I was like,
Yeah.
there's no context, like literally, and she didn't. I felt bad for her because she couldn't look me in the eye, and it was, you know, and it was and she was awkward, and so I felt awkward, and I work on these issues. So, you know, we ended up having, because of who I am, I ended up having a conversation, you know, with her. That was a really good conversation. But I thought about, what if we were at those tables, you know, when these national, you know, groupings of, you know, are crafting these toolkits and trying to give information to their members. We could at that point be able to talk about some of these issues so that, you know, folks on the ground, public health folks on the ground, won't feel like burdensome in asking these questions. You know what I'm saying?
Yeah,
So
yeah, absolutely.
I think that's a big part. I really would like to see folks mirror what you all have done and connect with national communities of color organizations. I think if it's one thing I want to, you know, I want to remind folks of, you know, as a tool, like, make those connections so that it's a long-term collaboration.
Yeah. I like that, and I think what you're speaking to is this idea that sometimes public health can be insular, and we have to think more broadly and do some vetting within our own systems, and recognizing that, yes, we may have the tutelage and the education, etc., but that doesn't necessarily qualify us as the only expert. So really broadening our ideals around who is capable to come to the table with solutions, or at least asking the questions so you stimulate the mind to think about what the solutions can potentially be. It reminds me of when you read about research studies for medication that are intended for women, and then men are used as a research subject. And it's kind of like,
Right.
like what's going on here, you know?
Right. And the number one thing you're taught when you think about public health is engage the community.
Yeah.
I mean, we're always talked about engaging the community. And so I think really being mindful about how are you truly engaging the community.
Awesome.
I would add to that a couple of things. One of which is that, we often hear when we start to have this conversation, this sort of level of fatigue, right? That oh, are we going to talk about this before? Haven't we had this conversation before? I've heard a lot of conversations about this, but the reality is that we're not getting it right yet. And so, this has to be an ongoing conversation around centering the needs of those individuals that are disparately impacted and have been disparately impacted for centuries, right, in our country. And that doesn't just change overnight. And so one training is not enough.
Right.
2 trainings are not enough. There has to be consistent training around the realities and how to engage with our communities. Because what Condencia says is so true, that, we often hear from public health officials, from doctors, et cetera, who are asking questions, like asking the question around intimate partner violence, and then not understanding cultural context around, and that person then gets labeled as combative or labeled, as challenging. And so there's not really an understanding of historically, what does it mean for people of color accessing medical care, right? And what is our interaction been with these systems? So the kinds of training, Mighty, that you all are engaged in through this webinar and this platform are incredibly important, and they're incredibly important that they be consistent, because what we are trying to interrupt is centuries of systemic oppression and centuries of racism. And so just talking about it, 1, 2, 3, 4 times is not enough. And that it's also important for us to check that ourselves. And when we're thinking about, as public health folks, to think about that, because you may hear it now and you may hear it 10 times, and you may hear it, 20 times, but to recognize what that looks like over the history of our country.
Absolutely. And speaking about the history of our country, we know there's so much that we can unpack there, but I'll leave that for another conversation. But what I would like to say is that violence is so embedded in our country. We see it in our households, unfortunately, in music and film and television. So it's normalized, unfortunately. So there's a lot of work that we need to do to dismantle this idea of violence being normal. But I want to jump to some of the questions that have been coming in through the chat feature. One of these you brought up earlier in your talk, Karma, whereas a nurse is inquiring about how to ensure that survivors are not criminalized for reporting incidents of IPV. And particularly, as you mentioned, having their children taken away. And as a nurse, she may be a mandatory reporter. So what changes in policies or practice can we institute to ensure that survivors are protected and not penalized for reporting an incidence of IPV? Or
one of the things that I say with medical professionals all the time is, just to start the conversation with making sure that the patient or the person that you're talking to is aware that you're a mandated reporter, right? That folks don't even know what that means. In community, we don't necessarily know what that terminology means, or know offhand that the person that you're speaking with is a mandated reporter. So just providing that information up front is critically important, and it allows the person to make certain choices in terms of what they are going to disclose at what point. And then that's also when resources, being knowledgeable, being educated, having gone through some kind of training around what resources exist are incredibly important, because our first response very often is, call this national hotline, or, call law enforcement. And we don't know the range of services that are available for survivors. So becoming educated about what is available in your community so that you offer survivors options. That's the most important thing for survivors of intimate partner violence, is recognizing that they have been in a controlled environment and in a controlling environment. And so having access to choice is incredibly important, right? When we say that your only choice is to call law enforcement, then, you know, the person doesn't feel, they feel like either I turn to this system or I stay in an unsafe environment. So as public health professionals, one of the most important things is to become educated about what are the range of resources available, and how can you offer them to the survivors that may disclose to you. And then also allowing for there to be choice about, you know, when you disclose to me, here could be the range of consequences.
Okay, and presenting it as such a kind of a menu of options and not identifying one choice as the gold standard, because as we know, the individual circumstances may dictate which option they would exercise. Is what I'm,
Exactly.
okay.
Yes, that and not thinking that you know best, right?
Got
Is
it.
that in providing those range of options, it allows the person choice.
I have a question about CPS, but I want to get to these other questions. Maybe we can follow up with folks after. But we've talked a lot about survivors, and obviously we know that there's a perpetrator involved in that dynamic as well. So have either of you been engaged in or want to uplift any prevention or response programs that are provided to those? I'm always changing the word. The words are changing, but in this instance, I'll say perpetrator. Hopefully no one will be offended by that. But any response to that?
So there are a number of resources, and Mighty, we can provide information that you can forward out after today's webinar. Prevention-related resources for intimate partner violence, around intimate partner violence. Some directed towards the harm doer, right? Where there are violence prevention trainings, where there are organizations that look at how to focus on healthy masculinity, that work in schools, that work in communities. So a lot of programming around that, and also a lot of programming that works around primary prevention. So working in the school system, working with youth, working in community to identify what are those warning signs of an unhealthy relationship, and quite frankly, how do you have a healthy relationship, right? What are the tenets to and tenets of a healthy relationship? So training programs that do provide that information in a school context and in a community context. And there's a lot of resources available across the country that do lift up that program.
What we probably would want to do too, in that as we're showcasing resources for harm doers and for folks across the continuum, is also if there are any specific resources that we have that shed light on issues for LGBTQ populations or trans persons, and also acknowledging that there are some specific considerations there as well that we need to ensure that we're paying attention to. And I see that coming through the chat, so I just wanted to acknowledge that. If we don't get to those questions, we'll be sure to provide some of those resources.
And both Condencia, so CISE and Ujima both have on our website resource guides that highlight culturally specific organizations across the country. They're large manuals, so you know you can go to the resource guide, and they're coded by state. They're already available, and so those are other options. And they do highlight programs that are available specifically for LGBTQ communities.
So one question that I'm seeing we're getting a lot of, it's from folks who recognize that systemic racism and health inequities exist, and they are not represented by communities of color. They are white. So they want to know within their domestic violence organizations or within their position as a white person, what it's what is it that they should be doing or looking for and doing differently to ensure that the issues of communities of color, Native populations are addressed even within their organization if they're not fully represented on the board, staff, etc. What kind of shifts do they need to make happen in their programming, but also maybe in the leadership of the organization as well?
Okay. So, you know, we always go to, you know, when you're in the leadership of the organization, really allocating resources for communities of color, right? And not just, you know, one of the things that we often think is that, you know, developing a one-off program will solve it. And really, when we think about culturally specific programs, it really is about investing in culturally specific outreach methodology, getting educated, so training and technical assistance for your organization. So you're looking at, how do we do board recruitment? Where are staff within our organization? Are they only on the front line, or are they in decision-making positions within our organization? Looking at, as Condencia said, the language that your organization uses. Is the language that you use relevant to the communities that you serve? Looking at the programming, you know, when we say, and Condencia said it earlier, when we talk about core services, who is it core to? Is it core to all of the communities that you serve, or is it core to a particular population, right? And by default, what we hear from a lot of our colleagues in community is that when they think about providing culturally specific services, they think about, you know, translating materials, making sure that they have food available, you know, in mainstream organizations. And it goes much deeper than that, Mighty. So it's everything from looking at your outreach, to looking at how you develop policies, to looking at who has influence within your organization, and whether or not the community that you serve is reflected in that decision-making process. It's looking at how you engage survivors in developing decisions, right? Do you ask survivors, what has been your experience in our program, and can we incorporate any changes, right? And making sure that it's from top to from the decision making, so from the executive level all the way to those individuals that are on the front line of our organizations.
Thank you for that. So we have a lot of questions coming in about LGBTQ identified populations, and to your knowledge, do you, or through your organization, are groups that identify as such also given gender and culturally specific resources as well, would you say?
So yes, we work very closely with, within our organization, we work within a national resource center that focuses on intimate partner violence, and there are organizations that specifically focus on a wide variety. Our organization specifically focuses on the Black community. There's an organization that focuses on the LGBTQ community. There's organizations that focus on the Native community, Latina community, Asian community. So a wide range of organizations, and we work together to not just influence policy, but also program and research.
Awesome. What are your thoughts on survivors and how they should engage in a healthy manner in this work as an ally, but also as someone who can bring their lived experience to prevention and intervention mechanisms?
You know, one of the things that Condencia and I talk about very often is that survivors absolutely should be engaged in our work, but very often, you know, we think about the survivors as the them rather than the us, and that, you know, oftentimes you're talking to survivors when you're talking to individuals working in programs. So making space for individuals to identify as survivors and to bring voice in their current role and current perspective and that reality. In addition to, you know, making space for, we do regular listening sessions in my role at the DC Coalition, regular listening sessions within our organizations with survivors, so that survivors have voice. And we do so in a way that is confidential. They get to provide feedback about the programming that they are receiving, and then we provide that to the organizations that they interface with. And we do that not just with those domestic violence organizations, but we do that with, what has been your experience with medical professionals? What has been your experience with law enforcement? And provide all of that, all of those responses back to those systems that they engage with.
Interesting. One of the things that has come up again is that if if someone doesn't have access to technology, so we talked about COVID and we know more folks are staying home and they don't have a cell phone or other means of communication, are there uh, opportunities or what's being done to engage folks in that circumstance where they just don't have access to communication technology, but they're also maybe living in fear? So what's being done there?
So again, you know, most of the organizations that Condencia and I work with, they are still open and are available and are providing outreach services.
Okay.
So people are going to community through mobile advocacy services, et cetera. People are going to community and providing the services. So they're not just relying on individuals to contact them through technology. And then in those spaces where we actually have access to technology, they're actually providing the technology to them. So if they know a survivor does not have a laptop or does not have a cell phone, and that's a necessity, they're making sure that they make that available.
Yeah, and I will definitely add that, you know, and especially, you know, for myself, is I'm always challenged by technology, as you can see today, and my camera going on and off. So I can totally appreciate, understand, and one of the things that I you know I love about what our programs are doing is that survivors that they have been working with, they know have. I mean, that's one of the first things they did was try to assess what capacity did you have by virtual, by phone, by text, what capacity did you have? And for those that they were able to provide support by giving them tools, they did. And for those who they couldn't, as Carmen was mentioning, they've actually made regular check-in lists where they will do, they will try to, drive by and, check in on those survivors. They'll let them know, I'm in the office, on this day, if you want to come, if you want to come in, they'll call. They have cell phones that they're able to give folks to call into. And so really, one of the things that programs have been doing is intentionally trying to check in even more often on those survivors that they know don't have virtual access. And again, even that means there are some of our programs are, driving by and dropping off food and inserting notes into the bag of the food. And so, really trying to be creative and how they're getting, information and letting those survivors know that they're there and they're here to help.
Thank you for that. So some folks are asking about if there's maybe one specific, I know there is, again, a multitude of ways to intervene or to prevent, but if there's one that either of you can uplift that you have found to be effective, or a service that you have utilized or a service that you provide that's often utilized, if there's a specific culturally specific example that you can provide that they maybe can reshape in some manner in the work that they're doing.
Mighty, can you ask that question? If there's something
Sure.
that
Yeah, they want to. Well, yeah, so people are asking about like a specific component of the work that you're doing that is either a service that you're providing for prevention or intervention that may or may not have a culturally specific bent to it, but they want to hear from you, so if it's something that they can take back and build on their own within their own organization. So, yeah.
I think, Carmel, I can't see. I don't know if Carmel's going to jump in, but I think one of the things is, I would say that if you don't already know the culture civic organizations within your community, if you're not a culture civic organization and you don't know who they are, I think reaching out and connecting with who they are, I think that would be super important. And in order to find out, and like Karma said, on our websites, there are lists of communities of color organizations across the country. We do have areas where there are gaps, where there are not communities of color organizations. And so if there's not one in your area, please feel free to reach out to, Karma in terms of intimate partner violence at Ujima, or CSA, and we will certainly connect you with someone. If you don't already know who they are, we can certainly do that. That's one thing that I would say. If you don't already have a relationship with the community, with community programs or community stakeholders, then I would say look for ways to be able to make that connection. And the reason why I say that is because, you know, when you think across the country, there are different pockets of different communities, and we want to be mindful of that. Our communities are not monolithic. Did I say that right? Monolithic, right? They're not all the same, basically. I should stop trying to use big words.
Yeah, yeah. And then what it sounds like you're saying is that you have to take in the community context when you're developing those services to ensure that it is person-centered, community-centered, so that those needs are being addressed in an intentional manner, as Karma noted.
What Mighty said.
Okay, so I do have a question, and we're coming up on time here, and I think we have time for a couple more questions. One question that keeps coming up is this idea around men also being survivors of intimate partner violence. But Karma, you mentioned this ideal of, or this falsehood around around masculinity and what it means to be a man, and so there's stigma around reporting or even telling your story. Is there any thoughts that you have around how we shift the culture to have a broader appreciation of the collectiveness of survivors of intimate partner violence?
Absolutely. So, you know, there are all of our organizations, the organizations that we work with do serve men, women, and children. So I should say that, you know, we do serve men, women, and children, survivors of intimate partner violence. But certainly there are differences in approach and differences in need. And so, you know, the organizations, particularly culturally specific organizations, are adept at making those shifts and ensuring that they are providing services that address the very specific needs of the individuals that are accessing them. But there are also organizations like A Call to Men that work specifically around healthy masculinity and work in our communities to address and to provide programming around them. And I think as we think about the intimate partner violence and the instances of intimate partner violence in men, women, and children, certainly women are disparately impacted by domestic violence and sexual assault. And so that's why you often hear us talking and saying women, but we recognize in approach and recognize in services. So for instance, Ujima has had several roundtables around serving men and providing specific services for men who are survivors of intimate partner violence. And so what does it look like for us to have specific support groups for men who are survivors? What does it look like for us to have specific outreach materials for men who are survivors? Because it's important as we talk about, you know, women seeing ourselves and women of color and communities of color and Native women seeing ourselves in the materials, that is also important for men and male children to see themselves in those materials as well. So making sure that the range, that we are addressing the range. Sorry, and I know we're at time. So
No, it's great. I mean, I could talk to you all for a long time. I know we scratched the surface on many issues, and there are opportunities to dig in deeper. So hopefully folks will join us as we continue in the series, but also hopefully this served as a catalyst for you to keep these conversations going within your own circle. So in 15 seconds or less, Karma or Condencia, do you have any closing remarks that you would like to leave the listeners with?
I'm always checking for Condencia's mute button, but you know, just I would just say thank you, you know, to you, Mighty, to Yeto, for hosting this webinar. One of the most important things, you know, is that having these platforms to lift up the needs of our communities, to talk about the history of racism and institutional racism in our country and how that has impacted the survivors that we work with, and the need for culturally specific approaches. So I appreciate the platform today. I appreciate the individuals that have called in. And I would just finally lift up the need for a continued conversation and continued education around how racism has impacted our communities, the intersection with intimate partner violence, and the need for culturally specific responses.
Awesome, thank you. Condencia, anything for you?
Yeah, again, thank you so much. And I'm so sorry that my video is acting up and I cannot have you all see, you know, who I am. You'd be so impressed if you could see me.
I'm certain of it.
I do want to let folks know, I think one thing that I would say is have the conversation within your space, within your office space. I think provide opportunity either to, you know, through dialogue. I mean, now we have to do these things over Zoom, through any way to be able to send in information that might be anonymous, but allow for these conversations to happen within your spaces, in your public health department, in your staffing. Allow for conversations around what grade do we think we would give ourselves for our responses to communities of color around these issues? What do we think? How do we think we are doing? And allow for people to be able to put that forth in a real, frank, and honest conversation. You might find that there are people within your agencies that have some really critical thoughts that, you know, they've just been waiting for an opportunity to lift up. So have these conversations in your spaces and let them be honest and open.
I love that. Great way to end honest and open conversations. Thanks to everyone who tuned in and listened to us today. Thanks to Maria, Haley, Yeto for the organization of this webinar and this dialogue. And of course, thank you to both you, Karma and Condencia. Until the next time, see you all later. Bye-bye.
Bye.